Bernard and Rebecca. Bernard was appointed CEO of Youth Live4Life in May 2018. And in that time, it's just gone great guns in terms of expanding to rural communities, and was also highlighted as a case study in the Victoria's Royal Commission. And Rebecca likewise works on that and has, years of, or a couple of decades of experience with youth policy, advocacy and social programs. So I think at this point I will stop sharing and hand over to Bernard and Rebecca, who are going to give you a lot more information about the Live4Life model. So I'll stop sharing my screen and over to you guys.
Thank you, Nikki, and thank you, Vicky, for that introduction and also the acknowledgement to country. And I'd just like to acknowledge that Beck and I we're in Woodend on Dja Dja Wurrung land, and we'd like to pay our respects to elders past and present. And also just to say that as an organisation, we warmly accept the invitation in the Uluru Statement from the Heart to walk together with the Aboriginal and Torres Strait Islanders peoples in a movement for a better future. And just picking up, Vicky, on what you said, we'd also like to acknowledge those people who have been impacted either by mental ill health or suicide, and whether that's either by bereavement or living with the challenges of suicidal thinking. Mental illness and suicide do not discriminate, and we'd just like to acknowledge that too. And probably also important to just point out to everybody, the Live4Life model grew out of a need, and we have lived experience represented on right throughout the organisation, from the board level, through our subcommittees, through our staff, and through our partner organisations. We're going to have we're going to take you through the model and the evidence behind it and what we've been able to demonstrate the impact for it. But I thought we might just start, if we may. We've just got a 5-minute video that we just thought would just hopefully be able to really encapsulate what Live4Life is. It sort of goes through the founding story as well. So I'll just share that now with you all. Can everyone see that?
Back in 2008, part of my role here at Macedon Ranges Shire Council was to sit on a committee called the Local Safety Committee. It was chaired by Victoria Police. There's nothing like standing in front of 4 burly Vic Pol members, them in tears about their experience. I thought my kids were really well balanced, were achieving, they had friends, they had goals, they were happy. And then we went away one weekend and my daughter rang us in the middle of the night basically and said that Liam had killed himself. She'd come home and found him totally out of the blue.
I believe that if mental health education was in schools in a way that was comprehensive and actually helpful and real, maybe my brother wouldn't have taken his own life, and maybe we wouldn't have lost so many young people in the Macedon Ranges to suicide.
It was grand final weekend in 2008 where we lost these beautiful young men to suicide. It really was the catalyst for change. We had to do things differently.
So currently Live4Life is being rolled out in the Macedon Ranges Shire. It's being piloted in 2 other rural Victorian communities, Benalla and the Glenelg Shire, which is Portland, Cassidy and Haywood. So there are 4 key components to the Live4Life model. The first one is mentoring, support and guidance from Youth Live4Life staff. This involves helping bring the partnership group together within a community and helps with troubleshooting. We do a lot of on-the-ground support and we advise the community on how to roll out the components of the Live4Life model.
Do you like walking in the rain? When you think of love, do you think of pain?
I've just noticed the wider conversation about mental health is now actually happening.
The second component is the School and Community Partnership Group, which includes local government, health and community services and schools, who support and drive the implementation of the model.
Well, the community are really in support of this. It's been, I think, a real strength of our Shire because we know that there's different challenges for our young people.
Its main strength is it's grounded in community. And one of the main themes out of today was that there is a love within the tribe that Chris Thorne spoke about.
I'm really an advocate for anything that's going to break the stigma down, have people feel safe.
Young people are talking about mental health and they're supporting one another. They're smashing the stigma around mental health and it's reaching their parents and grandparents and the whole of the community.
The third component is evidence-based mental health education in schools and community. We target Year 8 and Year 11 students, as well as parents, teachers and community members.
In 2012, Brooke became really unwell with anorexia. When she was first hospitalised, the Live4Life program had run in her school and one of the kids came and knocked on my door and said, I understand what's happening for Brooke now. How can we help? How can we support you? For me, Live4Life saved Brooke's life.
As a parent of a young lady who suffered with mental health, it's really hard being that parent when you don't know what to do.
This program really gives young people a dialogue and a framework in which to sort of look out for each other.
It's important to learn about mental health because lots of issues arise and this is one of the big ones that affects lots of people in the world.
And the fourth component, which is the crew, so a youth participation and leadership program, and they are really the centre of the model. They provide positive mental health messages to other young people in their community.
It's run by youth and it empowers youth, especially with the Live4Life crew being the main drivers of the program within each community and within the schools.
We're in the 2019 crew. I didn't really know how to deal with it, but after joining this group, I've learned a lot of tips and skills to help other people as well.
Prior to Live4Life, I didn't know where to go for help, but Live4Life has taught me where to go and how to give help.
A lot more people are talking about their feelings and speaking about how they actually feel and not hiding how they feel to everyone around them.
Everyone seems to be more aware of mental health. People are more careful on how they treat people and how they speak to them, knowing that I'm making a difference in the community and within little, small circles of people. It just makes me feel good as well.
So that video it's a couple of years old. It was 2009, 2019 that we did that video. And since then, we've expanded. We're now in 9 rural communities across Victoria. We've successfully transitioned 3 communities to self-sustainability, our founding community of Macedon Ranges, and those 2 pilot communities, Benalla and Glenelg, now in what we call membership stage and self-sustainable. Are you sharing?
I'm going to try and share our slide.
Yeah, we're just going to share our slide deck. So Youth Live4Life is a registered health promotion charity organisation. It was established in 2015 and we're now the Live4Life, and so we're responsible for the Live4Life model, for both the fidelity of the model and for scaling it. And our vision is that all rural communities across Australia have the resources to be able to support, improve and invest in young people's mental health and reduce youth suicide. It's a community impact preventative model, simply.
All right, we'll switch just one sec.
Oh, sorry.
Tell me if this works. Someone can give me a thumbs up. Beautiful. All right.
Is that proper presenter mode? Beautiful. Thank you.
All right.
Thank you. Sorry about that. Look, we're not going to spend much time on the statistics. You all know the statistics. I just probably want to point out, the difference between rural and metro. Suicide rate is 40% higher in rural areas compared to metro. We know that suicide is the leading cause of death of young people in Australia. But a couple of other, important statistics is that, self-harm is approximately 30% higher in rural and regional communities than metro, and 63% of young people that are seeking mental health support can't find the support they need. That's compared to 15% in metro areas. And that's statistics from the Victorian Royal Commission into that mental health system prior to COVID-19. But I probably don't need to tell you all about that. I guess probably the important one to point out there is that 75% of people with mental ill health have their first episode during adolescence. So evidence shows that health promotion programs that operate in an environment of community wellness, they contribute to the promotion of strong communities and positive social outcomes for young people. When in the video, you would have heard Pauline Neal talking about that incident back in 2008, where they lost several young men to suicide. At the time, Macedon Ranges Shire Council and the partner organisation were developing Live4Life. They were looking at targeting at young people aged, sort of 18, 19 and 20, as they were the young people that they were losing to suicide. What they learnt, though, through their global research was that, needed to get in earlier. The process is that sweet spot for being able to embed positive help-seeking attitudes was around 14 years of age, increasing the likelihood that those young people would seek help and speak up. So what we're aiming to do is increase mental health knowledge, awareness of local professional help, build community resilience, and we're trying to decrease suicide, decrease barriers to help seeking, and decrease stigma. So the story so far for Live4Life, since its inception, over 11,000 secondary school students have received mental health education, and over 1,400 adults have been trained in youth mental health first aid. And that youth leadership component of the model, the crew, we've got over 683 young people that have volunteered and been mental health ambassadors. And actually, there's a bit of an update on this slide. Partner organisations, we've got over 100 partners now. There are active partners of Live4Life in their communities. I'll go back to, and I guess the only other thing, probably the only other thing to point out is, the Live4Life model has been recognised with several awards. Back in 2018, Live4Life won the Vic Health Award for improving mental wellbeing, the Youth Affairs Council of Victoria Rural Youth Mental Health Award for most innovative youth project or programs in rural and regional Victoria. And we're also highly commended for the Local Government Pro Award back in 2020. That was the 3 communities of Macedon Ranges, Glenelg and Benalla. And importantly, the Live4Life model has been recognised in the Royal Commission into Victoria's mental health system as an innovative community-led mental health solution for rural communities. I'm going to hand over to Rebecca now.
Yeah, thanks, Bernard. So I'm going to talk about the model of Live4Life, and you heard about it in the video. So I'm just going to expand a little bit on what you heard. There's the sort of 4 components of the Live4Life model: evidence-based mental health education in schools and community, the crew, the youth participation and leadership component, The partnership, so local government, local community health services and schools sitting together, and the mentoring and support from us at Youth Live4Life. So I'm going to just spend a little bit of time talking you through those different components. This is a partnership group in the Southern Grampians, so in Hamilton. The local partnership group really requires the commitment from senior personnel from local secondary schools, local government, community and health services. And this group drives the implementation of Live4Life in a community and is key to achieving collective impact. The partnership group meets, at least quarterly, often monthly or 6 weekly throughout the year, a calendar year. And requires to have oversight around implementation of the model in that community. We really see a partnership approach as an important component to reaching sustainability of the Live4Life model in a community. The way we work is Youth Live4Life don't implement Live4Life in a community, it's community governed. We're providing that support alongside the implementation. Live4Life is a long game, and partners work together to make decisions, share risks, ensure resources are required for implementation, are secure and embedded locally, and that both the opportunities and risks are shared across multiple partners. As you heard in the video, we support communities to embed mental health first aid education. So through the delivery of evidence-based mental health education in the community, the Live4Life model ensures consistent research-based messages, knowledge and language circulates within the community. This is essential in reducing stigma, increasing mental health literacy and encouraging help-seeking behaviours. Implementing this component of the model includes identifying and funding the training of appropriate local community members, enabling them to become accredited youth and teen mental health first aid instructors. Delivering youth mental health first aid courses to teachers to saturate the adult community, whether that be parents, sporting coaches, carers, community leaders, anyone who's in a position and is able to be responsible and is a trusted adult for young people. Delivering teen mental health first aid courses is to all year 8s, and then either year 10 or 11, year 11 students across all schools in a community. So government schools, private, Catholic, often flexible learning settings as well. By investing in the recruitment and training of local instructors to deliver mental health first aid training in their community, the Live4Life model enables communities to build their capacity and ensure long-lasting impact by upskilling locals and ensuring they can maintain the mental health education of their young people and the community at little or no cost. You know, we're thinking about the rural context in terms of this. And then the crew. We know that young people want to hear from other young people when it comes to issues that impact them. So student representatives from years 9 and 10 from each participating local school are able to express interest and join a local Live4Life crew. The role of the crew is to assist in the delivery of events and drive key mental health messages at their school and in their community. The crew is supported by a local organisation with youth participation expertise. It often sits with local government and local youth workers. Crew members are engaged, active and invested in the mental health education and literacy of their peers and the wider community. They become mental health advocates and Live4Life ambassadors. The crew provides young people with the opportunity to be leaders in their local area and to advocate for mental health support and education in an ongoing and engaging way. And then a community has us, Youth Live4Life, and Bernard's laughing at this photo. We've grown a bit since then. There's 12 of us now. So our community engagement coordinators provide access to resources and guidance on the implementation of the model. They can assist in seeking funding, overseeing evaluation activities, and we facilitate communities of practice for both instructors and youth workers. We meet regularly with community lead agencies at supporting and troubleshooting their implementation. And we do this over a number of years. We work to increase each new community's capacity for sustainability, and this process might take somewhere between 3 and 5 years, we're finding a little bit longer at the moment. Beyond this, community would move into a membership agreement with Youth Live4Life, where we continue to support them and they have access to all our resources, but it's a bit of a lighter touch from our community engagement team. Don't know if you can see my daughter's little legs hiding behind that logo there. So we've developed program logic and a theory of change. The Live4Life model places young people at the centre, ensuring they receive evidence-based mental health education. It builds the capacity of their peers to identify an emerging mental health concern and seek help, as well as reinforcing the formal education component through repeated and engaging mental health promotion messaging delivered by the Live4Life crew. It also ensures adults in their lives are trained to have the skills and confidence to respond when needed. And taken together, these components aim to ensure that young people who experience mental ill health are referred to appropriate clinical supports. Further to this, where young people experience access issues and lengthy wait times to access supports in their rural community, Live4Life aims to better resource the community to support these young people in the interim. You know, it's that thinking of like, who's holding a young person between their fortnightly or monthly or weekly session with a therapist that they might luckily have got into. It's their families, it's their schools. We want to make sure those people are armed with a language to sit with those young people. Over time, the critical mass of community members educated in mental health influences broader community attitudes and behaviours relating to mental illness, creating sustainable and long-lasting generational change. Just a small wish. This is just to give you a little bit of a sense, which we've touched on already, just that what the stages are of implementation of Live4Life in a community. So we have 4 stages, and I've talked to them. You've heard us talk to them a little bit already. Activation stage is sort of the first 12 months. It's really when we first start working with a local community. We run an expression of interest process, so we don't go where we're not invited. Communities invite us in. And when I speak about communities, it's a local government area, and who reaches out varies in terms of that first engagement. But ultimately, we end up sitting with local councils, local schools, and other health and community services to establish that partnership group. So we're doing that in that first year. We've established who's going to be the lead agency. We've recruited a local coordinator, and we're working on our engagement communication work plan for the year ahead. We then move into implementation, which is the sort of cycle of Live4Life annually. And then the idea is that through that period of time, we've got this transition tool we've developed, which is around moving to sustainability, and we're working with that community to reach a place where they're confident to implement Live4Life with a lighter touch from us. So we work through a transition stage and then into membership. And as Bernard mentioned, we've got 3 communities in Victoria currently in membership. We are working with 9. We've got a further 3 coming on next year in Victoria, and 1 that will be outside of Victoria. I think I'm going to hand back to you, Bernard.
Thanks, Beck. So over the years, you know, one of our critical, one of our high values is being evidence-based and evaluation. And Macedon Rangers, when they were developing the model, sort of between 2010 and 2015, undertook 5 years of programmatic evaluation to ensure that the model was right. When we got funding in 2017 to trial Live4Life in the 2 pilot communities of Benalla and Glenelg, we had Origin, Jo Robinson and her team undertake a 1-year evaluation of Live4Life in that first year of implementation. And based on the results of that evaluation, we got the attention of the Department of Health and importantly, the then Minister of Mental Health, Martin Foley. And he asked, they were impressed with the model. What do you want? And back then it was Rebecca said more money for more evaluation, and they funded a 2-year independent evaluation that Ludowick undertook for Benalla and Glenelg. All the evaluations are on our website that you can read there. So importantly, it's the impact. I mean, what the evaluations have seen is that, well, basically Live4Life is encouraging help seeking. 1 in 4 senior students have sought support for their mental health. 3 in 10 senior students have sought support on behalf of a friend, and more than 9 in 10 young people are having conversations about mental health with someone else. The Ludowick evaluation also showed that the peer-led component is critical. The value of peer-led messaging about mental health was consistently confirmed, and the crew members and their parents consistently reported that their involvement in Live4Life had been profound, and for some, it was transformative. Crew members also reported having increased leadership skills, more confidence to undertake public speaking and advocate for issues they cared about, and had a deeper understanding of mental health issues and competence to support others. We recently ran a crew camp. We had 60 crew members who came away on a camp during the September school holidays, where they undertook further mental health training, advocacy work, public speaking, media training, etc. And it was fantastic that I think it was about 2 weeks ago, we had 2 crew members down in Gippsland were interviewed on the ABC Gippsland radio on the lead up to the 9 a.m. news. And it's incredibly powerful when you're hearing these 15 and 16-year-olds just speaking so eloquently about mental health and care for others. Other key things that were identified from the Ludowick evaluation was that embedding the model at a local level is protective, and that it helps protect from any government changes, whether that's state or federal, or any policy changes. Live4Life aims to create generational change and needed to be maintained in a community over many, many years to create lasting impact for a community. As Beck said earlier, ours is a long-term change agenda that we're trying to assist. What was also shown was the importance of Live4Life for those who need it. Young people are extremely appreciative that their school and community were investing in mental health education. 65% of young people found Live4Life useful in that particular year, and with 75% expected it to be useful in the future. We also heard stories and we continue to hear stories from our communities of when mental health first aid training has saved a young person's life, where young people, parents and teachers have been able to utilise their training to support someone in a crisis. And the other probably 2 points I just want to highlight is that communities are more resilient and networked as a consequence of Live4Life. That was continually shown up in the evaluations. Having strong networked schools and health services was considered to improve community resilience more broadly. We actually saw that firsthand with the outbreak of COVID-19 in March 2020. And finally, adults are more confident to support a young person with a mental health need. 82% of adults surveyed reported more confidence to support a young person with a mental health need after training, and that was up from 32% pre-training. I mentioned earlier that Live4Life is mentioned as a case study in the Royal Commission into Victoria's mental health system. And then, we are very excited to be working with Nikki and a team and Monica on a multi-year evaluation of Live4Life. The primary aim of the project is to examine whether the Live4Life intervention projects protects and promotes mental health and wellbeing in young people in regional communities. A secondary aim is to explore the implementation-related factors that contribute to mental health and wellbeing outcomes. We're also participating in Future Generation Global's multi-year social impact programs. There's 14 organisations that are part of Future Generation Global's multi-year impact program. So we're measuring the impact across a 3-year period alongside the other partner organisations. And we mentioned earlier that we are trialling Live4Life in another community outside of Victoria. That's through federal government grant through the National Suicide Prevention and Leadership Support Program. And part of that will be an evaluation on that community. Yeah, and we've also got other plans currently developing an evaluation strategy, and we're very keen to measure the impact of Live4Life in Macedon Ranges, Benalla and Glenelg, now that those young people are sort of in their early to mid-20s and sort of, catching up with them on more of a qualitative sort of study. And just to finish up, I just might give a little quote from one of the case studies, and sort of encapsulates what the impact that Live4Life can have. A teacher observed a Year 9 student in tears in the corridor when she should have been in class. Now that teacher, normally his intuitive response would have been to tell her to go and wash her face and get straight back into class. But having been involved in Live4Life and done the mental health first aid training as part of Live4Life, he knew he should engage that teenager. So he asked her what was wrong, and she shared a lot of details with him, and he asked if she was planning to hurt herself. And she said that she was, and he was able, thanks to the training, was able to take her and get the support that she needed. And we hear quite a number of these cases often. I might wrap it up here, and Beck will come back over, and just to open it up to